In the heart of an unsuspecting English community, the last person you'd suspect became the deadliest killer in modern British history. Dr. Harold Shipman, a trusted family physician, a healer turned grim reaper. But beneath the veneer of medical normalcy lurked a predator with a prescription pad. Known infamously as Dr. Death, Harold Shipman was responsible for the deaths of an estimated 250 of his patients. His weapon of choice? Not a scalpel, but a syringe. Yet there are depths to his darkness that few have plumbed. Beyond the staggering number of lives he extinguished, what is less known is Shipman's meticulous manipulation of records. He forged wills and falsified medical histories, casting shadows on the true health of his victims to mask his murderous trail. Even more disturbing, Shipman's killing spree may have begun years before his eventual arrest. Early signs, like discrepancies in his treatment of elderly patients, were overlooked. Colleagues and pharmacists noted Shipman's unusual prescribing patterns, but it wasn't until a local undertaker noted the high death rate among Shipman's patients that suspicions arose. It was his arrogance that led to his downfall. After killing Kathleen Grundy, he brazenly forged her will to benefit himself. This blunder sparked an investigation that would uncover the horrifying scope of his crimes. Shipman's method of murder was silent and deadly. He administered lethal doses of diamorphine, morphine's pharmaceutical cousin. To the outside world, these deaths appeared natural, the quiet passing of the elderly, many of whom were in good health until their last appointment with Dr. Death. His choice of victims was strategic. He targeted the vulnerable, the isolated, those less likely to be missed or questioned. Yet, some of his victims were prominent community members, which only highlights the indiscriminate nature of his evil. Investigations revealed a chilling pattern. Shipman often visited the homes of his victims under the guise of routine checkups, only to deliver their final fatal treatment. He maintained a calm demeanor, a facade of concern that deceived many. The full extent of Shipman's atrocities may never be known. His suicide in 2004 ensured that many of his secrets died with him. But forensic pathology has since evolved, with the Shipman effect altering how deaths are certified and investigated in the UK. Harold Shipman's legacy is not just one of death, but of betrayal. He breached the sacred trust between doctor and patient, leaving behind a scar on the medical profession and a series of questions about the nature of evil. This 5-minute journey into the shadowy practices of Dr. Harold Shipman reveals only a fragment of the hidden horrors perpetrated by Dr. Death. If you were chilled by this glimpse into one of the most disturbing cases of medical malpractice and murder, please like, share, and subscribe for more investigative deep dives. Together, we uncover the stories that must be told, the stories that caution us against the darkness that can hide behind a trusted face.